Facebook Live with GBMC Healthcare. Today we're talking about skin cancer and the different types. So let's welcome our guest, Dr. Arun Mavanur, surgical oncologist at GBMC Hospital. And remember, we want to hear from anyone watching. Please don't hesitate to ask us your questions. So welcome. So Dr. Mavanur, what is skin cancer and are there different types?
Hi there. Thank you for arranging this. I think it's an appropriate time to talk about it. Can you hear me?
Yeah.
Sorry. So I think the most common things we talk about is something called as basal cell and squamous cell cancers. And obviously melanomas of these three, the first two generally are considered a little more benign than the melanoma is. There are other uncommon skin cancers, I should say, but they're probably not sun damage related. So I think we'll keep our discussion to the first three.
Okay, and if you have had skin cancer, are you more likely to get it again?
Most people with an original, some sort of a skin cancer just denotes long-term sun damage.
Okay.
And so people with sun damage are more prone for more cancer. So yes, the answer in short is yes.
Okay, and what is the most common melanoma symptom? Because we always hear about skin cancer, but how do you know if what you're seeing is actually skin cancer?
Well, it usually is people who have had, say, a mole, which looks different.
Mm-hmm.
They might have noticed it for the first time. Most people don't have symptoms in terms of bleeding, scabbing, or anything over the mole itself, but any such symptoms are more worrisome than not. But most people just notice a spot on the skin. And obviously that should be checked out by a professional dermatologist or someone who deals with these on a regular basis, because most of the times you need a biopsy to prove what it is.
Mm-hmm. And how do you know if a mole on your body is suspicious or if it's just maybe a freckle or an age spot?
Well, some of it is when we look at any spots, we look at, it's basically everyone knows what the A, B, C, D, E of skin cancer, melanomas, right? Each one stands for A is for asymmetry, meaning if you draw an imaginary line in the middle and both halves look symmetrical to each other, it's less likely to be a malignant mole. If the borders are regular and not irregular, it's likely to be benign. If there can be some color variations even in a normal mole, but melanomas generally have a significant variation in the pigment or color. Anything above a size of a pencil eraser is usually what we look at. So that's D for diameter. And lastly, any what we call as evolving, which is scab, itching, bleeding, anything on a mole. But generally, anyone who has a mole should have a routine dermatological surveillance, meaning someone, when we go to the dermatologist, they actually take pictures so we can compare it and not rely on just memory of how things looked a year ago. So anyone with moles needs to have a routine surveillance.
Okay, that makes sense. So kind of track it yourself too. All right, is melanoma hereditary?
There are very few genetic abnormalities which can predispose people to melanomas, but by and large, the most people we see is non-hereditary. It's not a genetic-based mutation or anything. It can run in families just because, one, their skin types may be very similar, and more important, their sun exposure might be the same, meaning outdoor families do outdoor things, and so you're more likely to have more sun exposure. So it's not truly hereditary in the true sense of the word.
Okay, that makes sense. I never thought about it like that before. Okay, so we're talking about sunscreen, right? Everybody says SPF. We know we should put sunscreen on, but how often should you reapply that sunscreen to get the maximum protection?
So it to some extent depends because sunscreen goes away. Unfortunately, most people are very good at applying it this time, but not subsequently, especially if you're out in the sun, if you're sweating, if you're in the water, sunscreen tends to go away. General recommendation is every 2 to 3 hours, especially if you're sweating or if you're outside. And you can use a spray, but it just means you have to use enough of the spray. SPF of 30 to 50 is more than enough. After that, it gets more expensive, but doesn't give you much bang for the buck.
Right.
But it's very important, especially if you get into water or anything like that, that you reapply it after you come out.
Okay, so you mentioned the spray. I mean, I have a toddler, so trying to get him to stand still to rub all that lotion on. I love the spray, but is it as effective as using a lotion?
It is. Only problem with the spray is it's more difficult to know if you have covered all exposed skin.
Okay.
Because it sometimes doesn't show. But if you cover it equally well, it's as effective. It's just a means of delivering your sunscreen. But we just have to be sure that you're applying enough and covering all areas to make sure it's effective.
Okay, and if you sunburn easily, does then that put you more at risk of developing skin cancer?
Well, some people tan, some people sunburn.
Okay.
Both are really reactions of the skin to sun damage. But when you tan, it just means that your skin is producing more melanin, which is the pigment, in an effort to protect the skin. But both mean damage. Intuitively, it makes sense to think that sunburn means more damage, but a tan doesn't mean it's not damage. It's still damage to the skin. So both have bad connotations in terms of long-term sun damage.
So that's what I was going to ask you. If you tan easily, then does that put you less at risk for developing skin cancer? Or would it then just be harder to detect?
It doesn't. You still have sun damage. The least forms of sun damage are wrinkles, other aging manifestations on the skin. At worst, it could be something like squamous or basal cell cancers, and at worst, something like a melanoma.
Okay, so let's talk more about the moles. Let me go back to that. If I have a questionable mole, and we've done everything else, the A, B, C, D, E, how do we know then if we should get it removed?
Well, like I said, the next step would really be to consult a dermatologist most of the times. And if it looks or is it deemed suspicious, really we need a biopsy. Biopsy is usually what is called as a punch biopsy, which is done in the office. And depending on what the pathology comes, it can vary from a benign mole to an atypical looking mole to a melanoma. Then it needs to be surgically removed, depending on what that pathology shows.
And so let's talk about that removal process. Is it always an outpatient procedure?
Most of the times, it's very unusual for us to need to admit patients for removing the skin lesion. Most of the times, it's a day surgery, meaning they come in the morning, get it done, and go home the same day. It could be under local or general, depending on how big it is, where it is, and patient preference, really. But almost always, it's a day surgery.
And let's say that you do develop a skin cancer. Is there a way to tell if that skin cancer was caused by sun exposure or something else?
Well, most of the times we assume that most skin cancers are sun damage related. There are some certain professions, for example, welders, etc., who get an inordinate amount of, skin exposure to ultraviolet rays. or, some chemicals exposures can increase squamous cell carcinomas, especially on the hands. But by and large, the common assumption in people, of general, otherwise no occupational exposure is it's sun-related.
And are there any certain areas of the body that have a higher rate or a higher risk of skin cancer?
Usually it's the exposed areas, face, for example, back of the ears, back of the neck, where you do tend to get a lot of exposure. But no area is prone. Sometimes we see melanomas even on the bottom of the feet, on the soles of the feet, palms of the hands, under the fingers, nails. Generally it tends to be in exposed areas, but there are melanocytes in other areas which can turn malignant.
And what kind of recovery can you expect after a skin cancer removal procedure?
So to some extent it depends. If we have to do what is called as a lymph node sampling, depending on how deep the melanoma is. But generally, most people are pretty much back to, their normal within a few days, just 2 to 5 days at the most. Fairly, in terms of surgical procedure, most of the times is fairly, easy.
Okay. And so let me go back to the SPF, what we were talking about, the SPF, because we see a whole lot of numbers, right, always coming out. What number do you need, and is SPF that goes up to 2,000 really necessary?
No, it's probably 30 to 50 is more than enough.
Okay.
And anything higher doesn't necessarily mean you get more protection.
Okay. And then what about people of color? A lot of people will say, I don't need sunscreen. I have melanin, like you were talking about. Do people of color need sunscreen?
Everyone gets sun damage. Mm-hmm. The degree of sun damage tends to vary. Obviously, if you by nature have a darker skin, mm-hmm. like African American or someone from South Asia who tend to have a darker skin, you do have some degree of protection. That's why, but you still need sunscreen because you still can burn, you still can tan. Also, we find that people, African Americans especially, if they get a melanoma, it tends to be below the nails, what we call a subungual, or mm-hmm. on the plantar aspect, on the feet and palms. So it's uncommon, but it can happen. But everyone does need sunscreen because you do get sun damage. The degree can vary.
So is there anything else that people can do to kind of prevent some of that sun exposure? Maybe something that they can wear? Should they limit time in the sun?
So generally you would prefer not, the worst time is probably around about midday to around 4 o'clock when the sun is, okay. overhead and it's at its worst. If you can stay indoors during that time, you obviously protect yourself. We advise people to wear a hat with a brim, not just a baseball cap, so that protects it. And you do get clothing with SPF built into it, because normal clothing doesn't protect you from ultraviolet rays. But if you have an SPF integrated clothing, it'll prevent exposure.
So can you talk to me about some of the signs and symptoms of skin damage? Because I thought that all these freckles on my face are freckles, and come to find out, they're sun damage. How do you tell the difference?
So, the most common thing is mm-hmm. wrinkles,
Okay.
You find that some people have more wrinkles, especially around the face, neck, exposed, and back of the hands, things which generally tend to get exposed.
Okay.
You can get, superficial areas of dryness like keratosis.
Okay.
You can get pre-malignant lesions, which are less common or more happen in more advanced, but most of the times it is these areas of dryness, areas of you know, freckling of the skin, wrinkling of the skin, etc., etc. The thing is, it takes time. It doesn't happen in 6 months, it doesn't happen in a year. It takes years later that you see the manifestations of it.
So does skin cancer have an age that it tends to affect people? You said years and years of damage. Are you seeing young people with skin cancer as well?
You can, and they tend to, it's uncommon, but you can see younger people with melanomas. Sometimes you see them earlier, even teenagers who have had pigmented lesions develop. But the average age of the patient tends to be an older patient that we see, but it can happen at any age.
Okay, and then talk to us about, when we hear the word cancer, it's scary anyway, right? But when you hear skin cancer, how serious or how deadly can it be?
So, you know, things like the basal cell and squamous cell cancers, which are also skin cancers, generally tend to have a more benign course.
Okay.
The difference between that and melanoma, in melanoma, it depends on what is called as the depth of the lesion, how deep it is. Because if it is superficial, generally, you know, if the depth is below 1 millimeter, unless it has any adverse features, the risk of that melanoma spreading either to the lymph glands or anywhere else is not, unfortunately, zero, but minimal. Right. So it's not just the primary spot on the skin, but its propensity of going through different organs in the body that determines the outlook, really. So early melanoma generally has a pretty good outlook because the risk of spreading is much less. But basal and squamous generally have a more benign course, though obviously there can be exceptions.
Got it. Well, such great information, useful for all of us. Hopefully everybody watching got something from it, and our viewers will as well. So Dr. Mavanur, tell everybody where they can go to get more information.
Yeah, obviously the GBMC website will give you a lot of information. The Google has a lot of information, but unfortunately it's not edited. Right. You can't rely on that information always, unless you go to a reputed website, either from the hospital or the CDC or one of those reputed sites, which will give you reliable information. Otherwise, obviously, GBMC will have links to this, what we just talked about, and also, you know, appointments for dermatology, et cetera, which can be done through the website.
All right. Well, Dr. Mavanur, thank you so much for joining us today. And again, thank you for all that great information.
Thank you. Have a good day.
You too.